We continue our conversation on River City Hardball with Dr. Lance Snyder from Jacksonville Orthopaedic Institute. Doc, thanks for being back with us tonight. I want to ask you about the pitch clock. That's been a hot topic of conversation. Do you believe, in your opinion, that the implementation of the pitch clock in Major League Baseball is a issue in terms of causing injuries? What do you think about the pitch clock?
Well, I just don't see how it can be. I believe the president of the MLB, Tony Clark, came out and said that it was a factor. And then on the MLB side, they said there's a study out of Johns Hopkins that they didn't believe that it was associated with it. I just don't know how it can be. These are professional athletes, and you're saying that they're somehow would change their throwing motion or put more stress on their elbow because they had to hurry up and throw. And that just doesn't make any sense. There are studies that have shown that less rest, throwing with less rest and less days in between throwing is associated with it. Less types of pitches. So the more different types of pitches you have as out pitches, that is somewhat protective. And there have been several studies, about rehab, different types of rehab and how those could affect it. But I just don't believe that the pitch clock can affect the tearing of the ligament.
And I'm thinking about it too, Doc, that you have 16 to 18 seconds, almost 20 seconds to throw one pitch. I mean, I don't know how much time that you need to pick one pitch and throw it. So I don't know how, I agree with you. I'm not sure how that factors into it.
Yeah, it's just baffling to me that the players think that somehow that's going to affect them. I mean, you'd have to look at, do they have longer times with outs? Do they have more number of pitches to get an out? I mean, you'd have to look at all those factors, but I just don't see that could be related.
Other factors that people have brought up in terms of what they believe is causing Tommy John surgeries that we're seeing across baseball. We touched on this in our previous conversation. The elimination of sticky substances. There have been people that say, oh, baseball should bring back the sticky stuff to give these pitchers more of a grip. Maybe that gives them, an extra edge in terms of not being able to have these Tommy Johns. What do you think about that?
That's just not true. They're trying, as you know, I mean, they're trying to get more movement on their ball. And so they're chasing after velocity, they're chasing after movement, and they're just trying to say that somehow that's somewhat protective, and it's just not true.
Well, and my whole take on that, Doc, is they found an edge because everybody in competitive athletics is trying to find that edge, whether it's cheating, whether it's crossing the line, whether it's not. They're trying to gain that extra edge because think about it, we're the big leagues. This is the top, the best of the best. How can I gain the edge on that other guy? And a lot of it was the sticky stuff. You try to I think Tyler Glass now and some of these guys that saw extreme spin rates on their pitches. Well, there might have been something to that. Guys like Trevor Bauer, who had a Cy Young year with the Reds in a hitter's park, might be something to that spin rate stuff.
Absolutely. I mean, we talked about last time, if you get to sit in a major league dugout and you can see the ball movement, that the more movement, the harder it is to hit. And therefore they want to have movement, and they're going to do things to affect that type of movement.
Do you believe the use of breaking balls and breaking pitches has an influence on risk of injury with Tommy John?
No, it's not near as bad as we once thought. Some recent studies and recent data have just shown that that's just not the case.
What about, this is kind of the main thing that we talked about earlier, the velocity and the overuse. Are those the two primary causes for injury, do you think?
Absolutely. Those are the two major ones. There's a really nice study that shows that if you achieve over 95 miles an hour, that you have a significant increased rate of tearing your UCL. So it's velocity, and then it's overuse. Absolutely.
How do you fix that? I mean, if a guy's throwing 95, it's hard to tell him not to. I mean, how do you it's a hard question, and it's the $1 million question that everybody's trying to figure out. But a lot of these major league pitchers, the average is 94, 95. So what's the solution to that?
Well, that's a great question, and everyone's chasing that right now. I think that when I was with the Royals, we looked at um, different types of mechanical issues. So if your hip was off, if you couldn't locate your pitch because you had hip tightness or you had back tightness or you had an injury, I think the pitching motion is such that you have to maintain premier physicality through your whole strength cycle. And so by doing so, you can kind of protect that arm a little bit. And so that's where I think that the safety is going to lie, Andrew. I think you're going to have to be as strong as you can in your core, in your hips, your back, everything to be able to throw that hard.
Are there some guys that can throw that hard and maybe they're overusing that arm and elbow to maybe compensate for maybe the lack of core strength or lack of something else in their body?
Absolutely. You know, you see people, Lenka comes to mind. I mean, you see people with abnormal throwing motion, and you just know that guy's going to tear his UCL. You just know that they've created some strange throwing motion, and that ligament's going to go. So I totally believe that.
Okay, I'm a parent in Jacksonville. I've got a kid on one of these teams in high school that can throw 90 plus. If I'm that parent here in Jacksonville, how do I treat my kid? How do I treat my baseball player that throws 90 plus?
Well, there's some phenomenal baseball coaches in Jacksonville. So I get with a guy I trust, and I work on his throwing mechanics and how he throws. Number two, I work on the whole body. I have him work on his core, work on his hips, everything else. Number three, I have him play multiple sports if he can. Basketball works well with baseball. It's not the same throwing motion. There's different sports that work well together. And I think we're up to number four or something like that. But rest. We got to rest. So no multiple teams. If you're going to be on one all-star team, that's it. We don't need to fly around the country every other weekend showing off our arm strength. And developing multiple pitches. Work on location and work on multiple pitches. Work on different types of pitches. If you're throwing that hard, we don't need to just blow it by everybody every time.
And this would be a conversation with a coach as well. But if you're a kid that throws 90 plus here in the Jacksonville area, do you have a certain specific type of pitch count or an innings limit that you'd like to see a pitcher like that have?
So that's a great question. Jimmy Andrews set forth kind of some guidelines, and everybody has those guidelines. Everybody should follow those guidelines. And it has to do with numbers of pitches in a game, and it has to do with numbers of days of rest, and it has to do with numbers of innings. And we know that if you go over a certain number of innings, that you're at increased risk. So just your point is very well taken, and that's workload. And so, if someone's struggling and you see someone struggling and the game isn't that important, then get them out of there. It's not worth it to blow a kid's elbow out just to win a tournament.
Expounding on that, any other advice you would give a parent in the Jacksonville area or wherever they might be that you're listening here in Jacksonville and watching as well, but any other advice you would give a parent who has a kid that's maybe got aspirations for college and certainly a professional level that can throw at that velocity?
Well, so great question. I don't think anyone's made the majors being a phenomenal sixth grader. So I would go slow. I'd work your way up. I would get a team around you of people that you trust, trainers, physical therapists, so forth. And then I would work towards high school and the upper years of high school, trying to be great. I wouldn't worry about fifth and sixth and seventh grade. I wouldn't worry about any of that kind of stuff.
That's great advice. And listen, kids that throw 90 plus, that's not a small number anymore. These kids now, like we've talked about, Doc, bigger, faster, stronger. They've got these tremendous strength coaches and head coaches as well that can really push them hard, and they can throw hard these days. No question about it. Hey, final few moments here. The ace of the Atlanta Braves is Spencer Strider. He led Major League Baseball in strikeouts last year. Spencer Strider just underwent UCL surgery, and there's a procedure, Doc, that I've never heard of before until this year, and it's called the internal brace procedure. Spencer Strider had that. What is that, and can you tell us more about it?
So my buddy Jeff Dugas, who trained with Jimmy Andrews, he's kind of the guy who came up with it. He did the biomechanical testing, and so what it is, there's a company that came up with a high strength suture, and it's woven thousands of times, and this stuff is so strong you can't pull it apart. And he had the idea that instead of putting a ligament in there, if you put this fiber wire, fiber tape in there, and you could do somewhat of a primary repair, and you didn't have to drill the same type of tunnels, remove the same amount of bone that you had before, and you could just do kind of a minimal repair, and they might be able to come back faster. And that's what happened. So in positional players, they came back a lot faster. It's a little worrisome because honestly, Andrew, the technique's fairly easy. And so I worry that a lot of people are going to be trying this on a lot of people that shouldn't get it. But basically, it's just almost kind of a primary repair with this high strength suture. And we hope Spencer comes back, and we hope he's an ace, and we hope it works long term. But it is a little worrisome because the technique isn't very demanding, and we don't want people just doing it, willy nilly.
Is this kind of like a quick fix? Let's get you back in less than a year. How does this timeline compare to a normal Tommy John?
So that's a great question. It's about half.
Oh wow.
It's pretty amazing. I've had some positional players in town, and there are other doctors that can do it, believe me. But I've had some players that have gotten back at 4 months, 5 months, and definitely by 6 months.
So you've done this before. You've done this procedure.
Yeah, I have. I've also had players that haven't gotten back, Andrew, that still had some pain and still had problems. So it's not a panacea. It's not a perfect deal, but it is pretty amazing. I did one of our players at JU on the softball team, and she's just done amazing. She's back playing and really, really doing well.
How long has the internal brace procedure been around? Because I'll be honest, I've never heard of it before.
Oh, it's probably been around, I would say it's probably been around about 3 or 4 years.
So it's
But
it's really new then.
yeah, it's fairly new. It's gaining in popularity though.
So you've done it, you've performed it. How confident are you in the internal brace procedure?
So that's a really good question. So I use it in positional players that want to finish out their high school career or their college career. I haven't had. I mean, I have a talk with parents about using it in a pitcher. I've only had, a very small sample size of parents go that route. Most of the parents I talk to, if their son's a really good pitcher, they want me to go ahead and do a full blown Tommy John. So I kind of offer it to both parties, but I kind of have a spin on it. And I kind of, if it's my son and he's an ace pitcher and he throws hard and he wants to play in college or maybe even the pros, I'm going to do a full blown Tommy John because I know that works. I mean, I know that works. But a positional player, he's got a couple of years left, and we're not sure, how much longer they're going to play, and they just want to try to get back on the field as soon as possible. Then I would do the internal brace.
So let's explain to people the difference between the internal brace and the full-blown Tommy John, because with full-blown Tommy John, you take a tendon from somewhere else in the body and replace it there, right?
That's 100% correct. So we typically take a tendon in the wrist, the palmaris longus. We don't need it. Now, 15 to 20% of the patient population doesn't have one. So you got to check and make sure they have one. And sometimes you get in there and it's really wispy and it doesn't look great. In that case, there's a debate on what you should do next. And you can do one of the tendons from the knee, and that works really, really well. I usually use the gracilis. And then there have been people that have chosen to have an allograft, which is a donor graft tendon. So the technique is simple. You go in into the elbow, you split the muscle. In the original operation, they took the muscle off the bone. In the original operation, they move the nerve or they decompress the nerve. And I typically will protect the nerve, but I don't really try to mess too much with the nerve. I then go down to the ulna and I make some tunnels in the ulna. Some of the guides are pretty easy to do this. You got to know your landmarks. You got to know where the bony protuberances are, so you can put the tunnels in the right position. The area is called the subline tubercle, and so we drill a tunnel in that area, and then we connect the two. We connect the kind of the tunnels, and then we go over to the humerus on the inside, and we make a tunnel up into the humerus on the inside, and then we create two Y limbs. So we run this graft up through the ulna and then up through the humerus, and then we tie it on the back of the humerus, and it creates kind of a Y. And then we sew it back into the native ligament, and then we allow that to heal. Now, some guys are going out on a limb and they're putting internal brace with the repair, and that's a little dangerous. I've had to do 2 elbow scopes on guys that didn't get their motion because I think they were overconstricted and they were put too tight. So that can have some problems as well.
Couple more questions for Dr. Lance Snyder from Jacksonville Orthopaedic Institute, longtime team doctor with the Royals, with the Miami Marlins, so many years in the medical field, expert on elbows. You're hearing this conversation right now. It's fascinating stuff on Tommy John surgeries and really this breakthrough procedure called the internal brace procedure. That how effective has it been? I know there have to have been studies on it. Like, do you have a percentage on effectiveness on the internal brace?
Well, yeah, I mean, it's been very, very effective. The thing, Andrew, is that, there's kind of a wow factor to it. So you're talking about half the time, and I'm even having coaches and parents come in and asking me about it. And I'm just kind of cautious about telling them about it, saying that it's not 100%. I had a kid that had it done, and he went to University of Florida, walked on the team, and still continued to have pain. So it's not an end all be all. But it can be a good procedure.
The reason you've been a little hesitant, is that because it's a new surgery, or what's your reason behind that?
Yeah, correct. So I want to see the test of time. We know that UCL reconstruction works. Jimmy Andrews has been very honest about his technique and his complications and his the pitfalls of the operation. But we know that it's been around for a long time, since the 80s, and it works, and people come back and they do well. So I'm very reticent about getting a new tricycle. Surgeons, we don't want to experiment on our patients, and so we don't just want to just offer it to everybody and tell them that it's going to be great.
Yeah, because under the knife is very important stuff. You can't just go in there, like you said, experimenting on patients. You have to know something works for sure. The normal timeline for a typical Tommy John is what, a year plus?
Yeah. So I think Stan Conti had an article, and he showed that it's variable about when people get back. I think his earliest major league player was 7 months, and one player took about a year and 4 months. So I usually tell people, you're throwing a baseball by 4 months, you're on a mound at 7 months. Hopefully you're thrown in a game type situation at 10 months, and hopefully you're back by 11 months. Now, I will tell players that oftentimes they'll have a setback, and oftentimes they don't feel 100% like their normal self to about a year and a half.
And what is the timeline that we have seen in the recent years that it's been done for the internal brace? You said it's half that time?
So it's pretty incredible. So I usually let them start moving it right away. I let them start throwing really rapidly, like at 2 to 3 months, and then usually they're back on a mound by about 4 or 5 months, and then they're back in a game situation by 6 months.
That's crazy. I mean,
Yeah.
the good for medical science and the advancement of it. I mean, hopefully, like you said, it works. So, do we feel like Spencer Strider will be ready to go, good as new next year?
Well, I hope so. I really do. I love Jeff Dugas. He's a great guy. His heart's in the right place. So we'll see. We'll see if it stands the test of time. You and I will get to watch it.
Do you think this breakthrough with the internal brace procedure that, like you said, has been around for 3 or 4 years now, is this the future of Tommy John surgery?
Well, medical science is always advancing. I mean, there's always some smart guys out there thinking about problems and how we can get better. And I think it will continue to evolve. And I don't think that in the future it's going to be, a year rehab. I really just can't believe that. So I think we will evolve and with different techniques and get better and improvement. I think biologics are the way of the future. And I think there will be a way to add biologics to improve the internal brace. And then I think that, there may be some way to strengthen the ligament itself. So, and then rehab has gotten better. Different types of rehab have gotten better. And that's a whole other show. But yeah, I think we'll continue to improve and continue to evolve. I don't think that it's going to be the killer end all injury that it used to be.
Yeah, because obviously it's an issue with a lot of players having it. And look, the guys that have recently had it have also been very high profile names. We've seen Spencer Strider, Shane Bieber is the ace of the Cleveland Guardians. There's some prominent names that have had it, but it's certainly been something that has been corrected by a lot of these procedures. With Tommy John and now the internal brace. It's really fascinating that you've explained that. Is there final question, and I'll let you go. This is great stuff. The comparison between the full-blown Tommy John, where you take the tendon from elsewhere in the body, in comparison with the internal brace, is the procedure vastly different? Is it similar? How do you go about the procedure being different?
I I don't want to belittle the operation, but it's technically really easy. So the internal brace, I mean, you're basically putting a tunnel, and then you have to know where to put the tunnel, and that's been scientifically proven to where to put the tunnel in the sublime tubercle and the angulation you need to drill it at, and then putting it on the humerus is really easy. I did one today. It didn't take me very long. So they're just very easy to do, and it's just a little worrisome. You need to do a lot of them. You need to do at least 30 a year to get competent at it and to have the skill level to do it. But there's a lot of guys that can do it.
How many have you done of the internal brace?
Internal brace, I would think I'd probably at least done 100 or 150. I don't know.
What about total Tommy Johns in your career?
Yeah,
Ballpark.
I've done a lot of those. I've easily done over 200 of those, or probably 300, something like that.
Great stuff. Dr. Lance Snyder from Jacksonville Orthopaedic Institute. If you're a parent, if you're a son or daughter playing softball, if you have a need, go see Dr. Snyder, south location of Jacksonville Orthopaedic Institute. Tell us more about your practice and where people can find you, Doc.
Well, I appreciate that, Andrew. I just like talking about baseball. I love to see kids, and I love to help them. I love to help them get back on the field. I'm at Baptist South. I'm at JOI Baptist South. I'm at our location down there. And I always say I'm not a lot of things, but I am kind of an athletist. So we'll try to get you in as soon as possible. We get the answer. I am conservative. I'm going to try everything I can to not operate on your child. So that's our goal, to get kids back out there without having them undergo the knife. So,
Dr. Lance Snyder from JOI, thanks so much for your time. This was great stuff.
Thank you very much, sir. I appreciate you.